I'm Dr. Dan Rukeyser. Today we're going to cover some common problem areas on thrivalmusclerecovery.com. Hey guys, I see a ton of questions about the piriformis syndrome, and sciatica, so we want to clear some things up here. First of all, what is sciatica? What is the piriformis? What is piriformis syndrome? So let's talk about that. The piriformis muscle is a muscle that runs from the hip to the sacrum. And so in order to find it, if we were to touch the hip bone right here and then run down from the spine and come out to the edge of the sacrum right here, we're going to be able to draw a line straight through here. That is pretty much where you're going to find the piriformis muscle. The piriformis muscle is very strong. It's a hip rotator, but one of the most important things about the piriformis muscle is its relationship to the sciatic nerve. Keep in mind, the sciatic nerve runs straight off of the spine. The nerve roots come down off the spine, straight through the pelvis, and it forms this big nerve. It's literally as wide as your thumb. And so it runs down through the pelvis, and people are different. There are some people who have that sciatic nerve running straight through the piriformis muscle, splits the piriformis muscle. There are people that have the sciatic nerve that runs underneath the piriformis muscle, people that have it on top. And sometimes the sciatic nerve will actually split and the piriformis muscle will split, and we'll get an overlapping scenario like this. Because of the relationship between the sciatic nerve and the piriformis, we can tend to have a lot of nerve pain from a piriformis syndrome or any kind of problem in the piriformis muscle. Some very common things that we see, and these are all often called piriformis syndrome. When the sciatic nerve actually binds to the fascial tissue that surrounds the piriformis muscle, we can get pretty intense muscle pain and very intense nerve pain. We can have simple adhesion of the piriformis muscle itself. We can have adhesion of the piriformis muscle with the muscles above and below it. And we can sometimes get some adhesion between the piriformis muscle and the ligament that runs down along the sacrum. A lot of people will come in when I was in clinical practice and ask me, or tell me, really, they have sciatica. And they would have intense pain here. It would feel like a burning pain. They might sometimes even have pain running down the leg, and they would tell me that their doctor had diagnosed them with sciatica. Well, sciatica is a very specific diagnosis. What we mean when we say sciatica, we mean a sciatic radiculopathy. What that means is that the nerve roots at the spine are being pinched or crushed by the disc, by the intervertebral disc, pushing on the nerve root, and that causes pain down that sciatic nerve pathway. That is a very specific diagnosis. You have an MRI or something that shows you that there's pressure directly on the nerve from the disc. It's not just any kind of sciatic pain. Sciatic pain can be pretty intense and uncomfortable either way, but when it's a spine problem, when it's true sciatica or a sciatic radiculopathy, we've got a problem within the spine. That's got to be treated either sometimes with surgery, sometimes with an epidural injection, but certainly with some nerve flossing or some type of treatment to free up the nerves all the way up in that spine area up through here. It's a very different clinical picture when you have the sciatic nerve entrapped at the piriformis muscle. It still can be nerve pain, it still can be very painful, and it still can run pain down through into the thigh, into the leg. Sometimes the best way for us to find this is just to literally feel the piriformis and feel the movement between the piriformis muscle and that sciatic nerve. it's not real hard to find the piriformis. And so if you're doing treatment on yourself, if you're doing self-myofascial release, then it's easy to find the piriformis muscle and it's easy to work on it. So you just, again, you go from the hip straight across towards the sacrum, and right in this area you're going to be able to get on the piriformis muscle. The problem with that, again, is that you might find a very tender, painful spot somewhere along the piriformis muscle and think you've got a trigger point or something like that there, but really that could be the sciatic nerve itself. And if you decide that you're going to work a trigger point machine on that, or any kind of lacrosse ball or foam roller, if you think that you're going to work that out, you might actually be irritating the sciatic nerve, which obviously can be a big problem. And so what we're going to want to do when we get to this area is be careful that we're not creating more trouble than what we're fixing. If you get on that area and you're working on the piriformis muscle and you find that it's burning or it's sending intense pain down the leg, that's not the spot to be on. You got to get off of that. You got to get either more to the outside or more to the inside, because we have the sciatic nerve running straight down through the piriformis this way. So if we get on it by accident, what we want to do is we want to either move more to the side and get off of it, or move more to the midline and get off of it. So let's talk about the piriformis muscle and what you can do on your own to stretch it or to actually work the nerve through and keep that nerve from getting caught up or bound up on the piriformis muscle. So you can go ahead and lay on your back for me. So Mackenzie has moved to a supine or a position where she's lying on her back, and we're just going to show a little bit about how to stretch the piriformis muscle. What we want to do is we want to get the hip into flexion and external rotation, and it's sort of like a figure 4 on top of the knee here. Go ahead. Just like that. We get a little bit more stretch by if she grabs her knee and pulls up through here. Now, we're working on this side over here when she does this. And you can feel it. It's a good stretch. That's a great way to get a nice stretch on the piriformis muscle in a supine or laying on your back. Another great way to stretch the piriformis muscle is if you sit up, and you can do this. I love this one because you can do it anywhere. You can always find a place to sit and do this stretch. And so it's essentially the same idea. You're just going to put your leg into this figure 4 position. The key to this one, though, is to sit real tall. What you want to do is you want to sit tall, and what that does is that shifts the pelvis, and it actually will sort of traction the sciatic nerve through the piriformis and through the area, and that is a huge help in keeping the sciatic nerve from getting bound up with the piriformis. Let's talk a little bit more about where you might see piriformis pain and where you might feel it. I'll show you a little bit better if Mackenzie will stand up. So let's take a look again at where you might find the piriformis from this angle. If you find that bony part of the hip right in here, the greater trochanter, and you trace a line up to the mid part of the sacrum, right in through here, this line right here, that's going to be about where you're going to find the piriformis. Most times, you're going to have a piriformis binding or pain or adhesion right along where the sciatic nerve goes through or under or over the piriformis, and that's going to be right here in this area. Again, very localized pain right in this area. Most likely is going to be piriformis pain, possibly a sciatic nerve entrapment at the piriformis. Anything that radiates from the low back down through the glute into the leg is possible and likely that it's actually a true sciatica, a sciatic radiculopathy. And so we're going to want to do some more testing to clear that. But if it's just basically in this area and maybe down into the leg a little bit, it's likely that it's piriformis syndrome or a sciatic nerve entrapment at the piriformis. So hopefully that clears up some confusion about sciatica, piriformis syndrome, and sciatic nerve entrapment. Remember, you can always find more videos, how to find the piriformis, how to treat the piriformis on the website, thrivalmusclerecovery.com. Check it out.